Let's get started. It's 1 minute past. Welcome everybody to our joint webinar this afternoon that the CSP are hosting, all about enhanced practice, particularly looking at it through an employer lens. But of course, if you are here just out of interest, you are of course still very welcome. But we are really targeting a lot of the content towards employers as well. But we do have another webinar later on, I think it's next week, and we can you'll also be able to join that if you do have any questions that we don't cover today with the content. So you're very welcome. Lucy, next slide, please. So I'll just introduce ourselves and introduce the panel to you today. My name's Abi Henderson. I'm the Head of Workforce and Education here at the CSP and have been working closely with colleagues on the call today around the enhanced practice developments, particularly in England. So we have a great panel for you today, to which I'm very grateful that they're joining us. So thank you to all. We have Claire Ardito from NHS England. We have Louise Henstock from the University of Salford, and we have Kim Stuart as well from Coventry University, who have been absolutely instrumental in this enhanced practice work over the last couple of years. Next slide, please, Lucy. Oh, and I should introduce Lucy as well. Lucy's doing our tech support as well from the CSP, so thank you, Lucy, for supporting the webinar today. So just a little bit of housekeeping is obviously just please keep your microphones on mute. And you can use the chat feature to comment. We're going to leave lots of time for a Q&A at the end. There'll be lots of opportunities, so please use the Q&A function at the bottom of your screen to ask questions. But of course, any comments as we go through the chat, you're very welcome to place in the chat, and I'll place a few links in there as we go as well, if I can. And just to highlight that the session's being recorded, and we're doing this because we will then have it as a resource on our website, so you can share it with colleagues and others can also see. But what we will do is, although we'll record the questions today, we will edit those out, so the main portion of the webinar will be available, but not the Q&A. So feel free to ask any questions that you'd like of our panel today. Next slide, please, Lucy. So why are we here today? We're really here to really grow your understanding of enhanced practice as employers. So you're going to hear a lot today from the speakers all about enhanced practice. And while this level of practice isn't new, there has been a lot of recent work going on both in England and then some in Wales as well, to really describe and define what enhanced practice is. And that's in terms of the context of a career path for physiotherapists. And in England, this has been really built upon by the development of the establishment of the training route towards that level of practice. So this webinar is your opportunity to explore it more, really, inform your own thinking within your organisations, and follow this with conversations you think you can be having after the information you get in the webinar today. That's with your HEIs, it's with your teams, and then also at a system sort of workforce planning level as well. So our speakers really are the experts on this, so it's great to have them with us, and we built plenty of time in for a Q&A. Andrew, I can see that you've raised your hand. If you're having a technical problem, could you just bob it in the chat and we'll see whether Lucy can help you with it? Thanks so much. Okay, if you can flick on to the next slide, Lucy, please. So obviously my colleagues on the call are going to talk to you about sort of the nuts and bolts of enhanced practice, but I wanted just to spend a couple of minutes scene setting so we can really understand the context of the needs of our current and future workforce, and that will help us to position enhanced practice through this lens. So when the NHS was first established in 1948, there were 1.5 million people who were 75 years and over in England and Wales, and that's sort of 3% of the population. But the most recent census shows us that this number's tripled to 5.2 million who are aged 75 and over. So that currently makes up 9% of the population in England and Wales. So that's been a significant change. Next slide, please, Lucy. But of course, we know that people are living, they may be living more years, but living more of them in ill health than previously. And of course, that has an impact on health services and health demand and your services that you're delivering as well. Next slide, please, Lucy. And that's also reflected in the multimorbidity that's acquired with age. And we also know that this is starting from an earlier age than ever before. So couple this with the trajectory of an increasingly aged population, we're going to see the number of over 85s doubling between 2016 and 2041. So the demands on those health services will only increase. So what does this mean for our workforce? You can flick on, Lucy. So we hear from members like yourself so often of the challenges in practice for delivering services now. So this is in this context I've just described of complexity and multimorbidity, and of course the financial pressures that underlie that. And I'm sure most of you on this call today, you'll see that reflected in your own services. So we need a workforce that can best meet these increasing and changing needs of the population that are growing in that complexity. And obviously, the CSP won't recognise that some of that is about growing our own profession, and that's why we call for greater numbers of physiotherapists across the UK. But we also recognise the need to develop those physiotherapists and physiotherapy support workers who are already in role, and really recognise that need for the structured education and training pathways across all levels of the workforce. And that's to ensure that we have this confident, capable physiotherapy workforce who are really optimising their offer to patient care. And to date, we think that this area of the workforce has really seen underinvestment in its development. Alongside the development of the workforce, of course, within the NHS, we need to see retention within the workforce and efforts to keep people within the NHS as well. And it should be noted that nearly 7% of physiotherapists leave the NHS, and of those who do leave, nearly half do so within the first 5 years of their career. So physiotherapists, they need to see a career pathway through which they can progress if they really so they can see that pathway ahead of them. And with that comes with that needs a really clear articulation of what each level of practice looks like. And we're doing work around this with our forthcoming career framework as well. So we see this work in enhanced practice and this investment in enhanced practice really positive as a real enabler in this retention space. So we really welcome the developments, particularly in England, and which with the support of the enhanced practice apprenticeship, the model curricula and schema, and that's what you're going to hear about today. And we were a stakeholder in the innovation partnership with the teams who developed that work. Now, obviously, we recognise this work only really represents one part of workforce development, but we think it does hold great potential for patients, physiotherapists and employers. And of course, we would like to see a greater investment in this area of the workforce across the devolved nations as well. But as with anything, obviously what's going to be critical is how this opportunity is implemented, and there are many aspects to that. And one of those, and an absolutely integral one, is going to be the role of employers, and that's why we're here today to explore what that might look like. So to start doing that, I'm going to pass on to Claire. Thanks, Claire.
Thank you, Abi, and really pleased to be joining colleagues on the call today. And I'm just going to be just giving you a little bit of an overview from an NHS England perspective in terms of the context and the work that we've been doing. Next slide, please. So I'm sure most of you on the call will have either heard of the NHS long-term workforce plan or have delved into it into some detail to understand the intention to support and grow the NHS workforce over the next 15 years. And as part of that, there's some very clear descriptors in terms of what we do and don't need to do, and particularly to train staff in roles with the right skills and expertise and capabilities to be able to provide high quality care. And within that long-term workforce plan, there's a very clear description around expanding and developing enhanced practice roles alongside other roles within NHS careers. And as Abi's already described, this is really about us investing to ensure that individuals are able to progress their careers feeling valued and with the right skills, training and education to support them in that. So as part of that, we want to describe to you today the work that we've been doing over the last couple of years or so. Next slide, please. So some of you may or may not have heard about enhanced practice as a level of training. And one of the opportunities that have arisen within this level of practice is to support and develop individuals by using the enhanced clinical practice apprenticeship. All the resources that are available and are mentioned today are available for you to find out more. And the enhanced clinical practice apprenticeship was approved for delivery in May 2021. So we're quite a few years in now to this apprenticeship being available to us as a funded offer to support education and training at this level of practice. And we were very keen to ensure that using this apprenticeship specifically for the allied health professions meant that we needed to do some more detailed work, as the apprenticeship is multidisciplinary. And we were very keen to ensure that individual professions could gain accredited training and education in this space specific to their profession. So this apprenticeship is really, really imperative in terms of having another means by which we can provide accredited training within mid-careers. There are others, it isn't the only one, there's many others, and for some of you, you may have already gained training, accredited training at this level, but it's an opportunity to really explore and expand this as a training offer for individual AHP professions. And it is very much giving us a sustainable training offer where we know that funding and opportunities to support training financially is quite challenging. There is an apprenticeship levy that is aligned to this, which can be used by employers to support this as a choice for education and training. And it also offers an opportunity to do things slightly differently, to think about how we train individuals in a different way, widening participation, opening up opportunities perhaps to training in ways that we hadn't had previously. Next slide, please. So just to be absolutely clear that everybody understands the level of practice that we're talking about here, it sits very nicely, as you can see through this little graphic here, between preceptorship and foundation level practice and advanced practice, and can be seen as both a career destination for many who will be very happy to be working and exploring their practice at this level, or also as a stepping stone to further progression into more advanced roles or even to consultant level practice. And you can see there the expectation that there's a trajectory that within each level of practice that we would expect that capabilities are developed, expanded and progressed. And through this particular level of practice, we know that there is very much a much higher level of decision making, complexity in how we manage our patient care, and also developing specialist knowledge at this level of practice. We are very keen for individuals to be using this as a descriptor for the level of practice, not for the job role. And I think that's quite important because there will be a whole range of job roles that sit within this level of practice, where there are individuals who already have a designated role or title related to this level of practice. Next slide, please. So what have we been doing? Well, colleagues on the call, Louise and Kim, have, alongside some other university, have been working with us collaboratively and in a really fantastic way to support the delivery of and development of enhanced level schemas for each of the professions that we've been able to progress. So there's 10 professions included so far, and the others will follow. And this is to support and to align to the knowledge, skills and behaviours in the Enhanced Clinical Practice Apprenticeship. This is available now. It has been published and all the links are in the slides that are with you. But it's a really fantastic work which Kim and Louise will share with you, the progress and how we got to this place. Next slide, please. We're just going to share this little a little bit of information for you here, just so you get a little bit more understanding.
Did you know there is a new nationally recognised allied health profession-specific apprenticeship called Enhanced Clinical Practitioner? It provides an accredited training route upskilling allied health professionals to deliver an enhanced level of practice for patients. This will help the NHS achieve a key ambition in the NHS Long-Term Workforce Plan for England. Enhanced level practice builds clinical reasoning and skills to enable you to provide complex care and case management. It also establishes a structured career pathway, providing you with a clear career objective or even a stepping stone towards advanced practice. Supervisors will gain increased opportunities to improve their skills as educators, while employers can expand their educational capabilities and provide better support for staff retention. If you're an allied health professional wanting to advance your career, make a positive impact to services and patients, talk to your employer or apprenticeship lead to explore enhanced practice apprenticeships.
Thank you, Lucy. We'll just move on to the next slide.
Did you know?
Oh, thank you. So we have a range of resources available to you over the next couple of slides, which will be shared with you. And we really do encourage you to access them. For the schemas themselves and for information and advice, we do have a website on the NHS England website specifically referring to the Enhanced Practice programme. So everything's on there. Please do access that. And then on the next slide, there's a whole range of other resources that you might find helpful. Thank you very much, and I hope you enjoy the rest of the session.
Thanks so much, Claire. That's a really useful overview. And I've just bobbed those links from the previous slide into the chat as well, so people can access them more easily. Thanks so much. Okay, great. I'm going to pass to Louise and Kim now. Thanks.
Thanks very much, Abby. Lovely to have everybody here joining us today. We're just going to talk you through exploring an enhanced level practice. And as Abby have said, this is really targeted specifically at employers. So thinking about, if you're an employer, what the enhanced level practice would look like for your staff. Next slide, please. So this is what we're going to go through in this brief presentation. We're going to share some development of the schema and model curricula for enhanced level practice, particularly around physiotherapy, because we developed it across 7 AHP professions. We're going to outline the curricular development considerations for education providers, discuss the domains of enhanced practice for physiotherapy, and discuss the implications, for physiotherapy development in the workplace, and then also some considerations and thoughts of enhanced and advanced practice and the intersect that might be. Next slide, please. So I'm going to hand you over to Kim now, who's going to talk us through the first couple of slides. Thanks, Kim.
Thanks, Louise, and great to be here with you all this afternoon. So just to really explore in a little bit more detail, as Claire introduced, where this fits into the career pathways and scopes of practice that we have across our allied health professions. So it's fair to say, whilst this level of practice has been around for a significant amount of time, this work is really about capturing what does it mean with some coherence across our professions, but also in our individual professions as well, linking into your career development frameworks as well. So across all nations, what we did was took a look at what does it mean, how does it rest in different nations and different professions. And really what we've tried to do is capture some of that commonality and coherence across enhanced level practice. How we describe it in our schema and how we capture it in the work that we did was really thinking about the intersect between absolutely focusing on profession-specific mastery. What does it mean to be the best version of a physiotherapist working at this level of practice, really deepening and developing that depth of knowledge as a physiotherapist, but recognizing that actually that comes at an intersect of expertise as we work across different pathways. So for us, when we capture that idea of what enhanced practice is, it's really about profession specific and the intersect of sector and expertise and how that shapes how we deliver our daily practice. So the hallmarks that we pulled together were really reflecting around depth of knowledge to support complex decision-making skills. So really thinking about the complexity of practice and the acuity of our patient groups and people that we serve, and using that in order to really have strong clinical competence and judgment, and that you do that as a physiotherapist within that specific area of practice. We recognise as health professionals, we are already autonomous. So at the point of registration, we are autonomous practitioners. But actually, as we move through our career, as our scope of practice continues to grow, what we're delivering is exercising expert judgment as a physiotherapist, as that allied health profession, around that expertise that you bring within that area of practice. And in doing so, you will be drawing on criticality of thought and action as the basis of how you develop your evidence base, how you use your evidence, and how you draw that together in your everyday practice. And in doing so, you'll be using evaluative approaches, considering and interpreting and synthesizing information as part of managing that complexity of practice. But also that in growing and developing as we work towards these different levels of practice, that leadership spine that sits at the center of your profession is about recognizing within enhanced practice, it's about becoming a situational leader. That quite often when you're working at this level of practice, that it's about using your influence with or without authority. It's bringing and offering that expert leadership, that expert guidance that's centered on your professional thinking as a physiotherapist and influencing change and the lens of physiotherapy practice in how we support people and populations. Next slide, please. So what that actually was all then synthesized in terms of the purpose of the curricula was to absolutely maximize autonomous practice for allied health professions, to be values led in all of our actions, in our thoughts and our behaviors, and that continues across all levels of practice. That we needed to make sure in developing the schema and when we're representing enhanced level practice, that we're inclusive, that our mindset, our approach is inclusive of everybody and our practice is centered on inclusivity. Whilst the framework for enhanced level practice in the apprenticeship standard is multi-professional, we recognise that whilst we work as physiotherapists, I'm not one, I'm saying that globally, actually we work in a multi-professional way and that we celebrate that, but actually really understanding your depth of practice that is profession specific is absolutely important as our scope of practice and our level of practice grows. The more secure we are in our identity as that registrant with really, really sound clinical judgment, professional judgment, evidence base, as we move through our levels of practice, it becomes easier to operate in a multi-professional lens. That the curricula needed to be agile, both in terms of how it was designed, but also how we develop it and continue to move with it across the changing health and care needs of different sectors. That in developing the curricula, if you study it, if you are part of the process in terms of professional development, that through that engagement in professional development, you are committing to transformational change as part of your practice. Whilst this is very English-centric, system, place and neighbourhood, it equally is important in all of our devolved nations as well, about how the work of your practice is influencing the care of people and populations. And that when we did this work, it was about aligning to national frameworks that already existed. We weren't starting again. What we're looking at is how we bring it together in what is known and what other curriculum guidance there is. And that continuation from registration through to advanced and beyond is part of the journey. And that with the apprenticeship, actually, and with the work of professional development, it's about being employer-led. It's about growing and sustaining your local workforce, and that your local workforce is representative of the communities that you serve. So I'm going to hand over to Louise now.
Thanks very much, Kim. So let's talk about specifically the schema and profession-specific curricula for physiotherapy. So we evolved this work through lots of national stakeholder events, and they, alongside working with the CSP, our professional body, identified, broadly focused the following areas. Now, I just want to say, whilst you were looking at these areas, and they were some of the key areas that were identified through stakeholder engagement and with the professional body as drivers currently for the workforce, these are not exclusive, and these are just examples. We were asked to highlight some of those as part of our commission so that we could write specific pathways. And again, they're not exclusive. There will be multiple other routes through, but it's just as an example in the document. So we've got acute care, we've got community rehabilitation, frailty and healthy ageing, pelvic health provision, children and young people, mental health, learning disabilities and autism, and musculoskeletal. And those are the pathways that you'll see are given as examples throughout the document. Next slide, please. So within the physiotherapy curricula, and the document itself as it sits at the moment on the web page is a big old document, but you can move through and focus specifically on the physiotherapy section, which has the introduction to how the work is written. And you'll also see that it's written across 4 pillars of practice to enable our profession to develop to meet the needs of diversity of practice and our future career potential. Within each of those pillars, there are domains, and those are all mapped. We did big mapping exercises to map them to the apprenticeship standard, which is already written, and any professional specific frameworks. And again, we work closely with the CSP to look at the career framework and how that aligned. For physiotherapy and across each AHP, there are 8 core domains, and then there are 2 specific domains to each profession. And each domain has 3 levels of descriptors, which are becoming more specific as you move through. So there's an enhanced level practice descriptor, a profession-specific descriptor, and then a pathway example we've just seen of those workforce priorities. Next slide, please. So these are the 8 core domains of enhanced practice. That's writing's quite small, and you'll be able to pick up on that either from the links in the document or afterwards if you want to zoom into this presentation. But those run across all professions and are consistent across all professions because they are some of the core things, the top level descriptors that are aligned to all frameworks and the apprenticeship, remembering that we had to align this to the apprenticeship document. So you can see there that they're split into clinical practice, leadership, education and research, and the colour coding, so you can flick through the documentation fairly quickly. Next slide, please. So in addition to those 8 core ones, there are 2 specific ones that were pulled out for physiotherapy. And again, these came through extensive stakeholder engagement, looking at what was really important and specific to physiotherapy at this level of practice. And those 2 clinical ones there have been pulled out, and that was what was felt was really important to identify this level of practice in addition to the other 8 core domains. You can also see there underneath, as we've said, pulled out from the stakeholder engagement are the physiotherapy specific pathways. So through each of these domains, underneath each of them, there are examples of specific pathways for acute care, community rehab, frailty, healthy and ageing, pelvic health provision, etc. That will give you examples of what that domain looks like within this specific area of practice. And each of those specific areas of practice and those domains really sing physiotherapists. It's about what is particular to the language and skills and knowledge and behaviours of a physiotherapist. This work was all about embracing profession specific and celebrating what is crucial about physiotherapy at this level of practice. Next slide, please. I'm just going to hand over now back to Kim to talk us through the development.
So Louise has given you some insight into the profession-specific nature of the schema. What we also wanted to capture is how that learning and how that professional develop is situated across the workplace, recognising that there is academic development and then there is practice development in terms of the 2 areas that come together for enhanced level practice. So what we tried to capture is how that is a relationship between work-based learning, university-based learning, and in the realms of an apprenticeship standard, the occupational competency. So part of our ask in the commission was to be able to build a programme that was agile, that it responded to workplace needs as well as developing the workforce, and that it could be offered in a variety of ways to really maximise the opportunity for people to access this sort of development wherever they were. If we think about some of the work around rural AHP and people working in coastal environments, we need to make sure that everybody has access to robust professional development. So these three areas that we settled on were around work-based learning, and that's about taking the learning around enhanced level practice and applying that theory and practice within their employment setting, that it's a place for them to really reflect, apply and make sense of what it means to work at this professional level, and that is supported by the employer in the workplace. In the terms of an apprentice, it would mean a work-based mentor, and they offer that ongoing formative guidance to really allow them to integrate their thinking into their daily practice and assimilate what it means to work at an enhanced level. The university-based learning is really about using different learning and teaching strategies to build that collaborative space for learners to come together, to debate, to appraise, to look at new and emerging ways of working at enhanced level. And that might include skills, it might include new ways of working, it might be including looking at emerging technology. So lots of different ways, and that universities can design this in terms of being online and on campus-based sessions, and that will include simulation. And then occupational competency is the bringing of all of that together. And that's that practical learning and demonstration of working at an enhanced level practice, meeting the specific knowledge, skills and behaviours that we set out in the curriculum, and that is guided through clinical supervision. Now, that could come from a range of professions, but the work-based mentor really should be that profession-specific mentor, really guiding what it means to be that autonomous practitioner working as a physiotherapist. And that from an employer perspective, when it comes to the apprenticeship, you're going to be signing off this level of practice. You're going to be saying, yes, they are meeting that level of practice and they are demonstrating those competencies. Next slide, please. So we've given you an oversight of how the curricula was developed, how it's purposeful for physiotherapy, and some of the considerations, both from an employer perspective and how you might work with an academic institution in terms of delivering that education and professional development. But there are some things that we still need to work through. There's areas we still need to consider. And one thing we've been working really carefully on as a commissioned group, we still work together. So Claire hasn't lost us from her life. I'm glad she's smiling at that point, is actually we're trying to really be clear about what an academic level of practice is, what an academic level is and what a practice level is. And our example when we talk about that is if you look at pre-registration learners, they can exit university as a physiotherapist with a master's level qualification. That doesn't make them an advanced practitioner. It makes them a pre-registration entry point practitioner. So we've set this level of education also at level 7. Doesn't mean that they're an advanced practitioner. It means they are studying at level 7. However, the level of practice is what we are talking about, what it is that those competencies that they are demonstrating in the workplace are consistent with the level of learning that is academic. And we'll be continuing to explore this with you as employers and providers of physiotherapy, but also with your academic institutions. From an apprenticeship point of view, it's really thinking about the work-based mentors. So if as an employer you're thinking of implementing this, and I really hope you do, this is a great way to retain your workforce and to really drive that strength of the profession as they rise through into advanced practice as well. We need to build that work-based mentors, really think about that practice education lens, how we support people to develop in our workplace. And that actually as part of that workplace learning, it's how do we create opportunities for our learners in this level of practice that go beyond their immediate workplace? How do we open up those opportunities across our employment settings to gain that exposure and experience? There may be needs to bring in different clinical supervisors as part of signing off that occupational competence, and they might come from different professions, but how do we keep it focused around the competencies of physiotherapy. We absolutely must make sure that we are taking anti-discriminatory approaches in terms of who and how they access courses, how the courses are designed, and how occupational competencies are assessed. We've got to make sure we are inclusive and we are practicing through an anti-discriminatory approach. And then there's more to think about in terms of the sign-off of those occupational competencies. Then it comes to all of the conversations that we have at the minute about what does it mean about accrediting prior learning, so RPEL, and how does that work if we've got people wishing to move between levels of practice, both in terms of enhanced to advanced, but also there may have been other opportunities for professional development they wish to bring in and be considered as part of the enhanced level practice development. You will see shortly, we've been working on some guidance with Claire and the centre to bring out some guidance around managing accreditation of prior learning and experience. So that's to come, we're working on it and we recognise that's a priority. There's still more we can do around being clear around the distinction between enhanced and advanced programmes of work, both from a HEI perspective, but also as an employer, being clear about the levels of practice and the skill mix and how you see this developing in your workforce to drive that people and population health need. And then the final thing is within the apprenticeship, we're beginning to now really think about the endpoint assessment. It is non-integrated, and that means that in terms of the academic award, they will need to complete the endpoint assessment. That means there's considerations for you as an employer, the person studying the apprenticeship, but also the HEIs. So it's a three-way party approach to that non-integrated endpoint assessment. Next slide, please. So I appreciate that's a lot to take on board, but we wanted to make sure that we'd give you that information, but also be able to open up to any questions as well. So thank you for listening to our part of that presentation.
Thanks, Kim. Thanks, Louise. That was great. Lucy, you can just unshare, I think, at the minute.